Good evening, everyone. I'd like to call to order the Macomb County Community Mental Health Full Board Meeting for January 28th, 2026. Please rise for the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next will be the reading of the mission statement from Donna.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Donna. Next item is adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Megan, support from Wayne. Comments, questions on the agenda? Hearing and seeing none, all in favor say aye. Aye. All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak, come on up. Dr. Serpa, you get 5 minutes like everybody else. Can you do it?
Yes, I think I can.
Go ahead, doctor.
Well, good evening, everybody. I'm glad to be here with you guys and to be able to share this new piece of information that we have developing for MCCMH directly operated services. I'd like to take a few moments to update the board on an important clinical safety and access initiative we're launching across directly operated outpatient psychiatric clinics. As you know, many of the psychiatric medications we prescribe, particularly antipsychotics, mood stabilizers, and certain antidepressants, carry known cardiac risks that require periodic EKG monitoring. Historically, obtaining EKG for our population has been a challenge. Patients often need to travel to outside facilities, hospitals, hospital-based, face long wait times or miss appointments altogether, which can delay care and increase risk. To address this gap, we're launching Cardia 6L, and you guys will, I think Sandy disseminated some information about that, summarizing some of the basic aspects of what Cardia 6L is, which is a clinically validated EKG software solution, which has been FDA cleared across all 4 of our directly operated outpatient clinics. All the programs are going to have access to this. Our RNs, this will allow our RNs and prescribers to obtain EKG directly in the clinic, either during an in-person visit with us or as part of their scheduled nursing support. And that technology is technically portable, efficient, and integrates well into outpatient workflows. So from a patient safety perspective, this improves our ability to monitor for cardiac risk in these patients. Any medications that require closer surveillance identify potential concerns earlier and support safer medication initiation and continuation by our prescribers. Operationally, this also supports our clinical teams. It reduces administrative burden, it streamlines workflows, and allows prescribers to make more informed decisions in real time. Importantly, this is not increasing the scope of the practice, it is enhancing our ability to meet existing standards of care more reliably. And from a cost and value perspective, integrated Cardia 6L on-site reduces unnecessary referrals, limits missed appointments, and optimizes provider time while enhancing compliance with monitoring standards. This is a low resource, high impact investment in patient safety and operational efficiency. And I'm certainly excited to come and announce this to you. We will be rolling the official launchings in February. We're still fine tweaking some details. The RNs have been debriefed. Our doctors were debriefed today, and we are pretty much just working on some fine tweaks to our procedure that is going to come along with this. And yeah, overall, this initiative, like I said, it strengthens care quality, supports patient-centered access, and is a responsible investment for our system. So I appreciate having the opportunity to share it with you.
Thank you, Dr. Serpa.
Thank you. Good
Are there,
evening.
before you run off, are there any questions or
Oh, yes, please.
comments or anything? Okay, I don't see any, but Tracy?
Question,
Go
I
ahead.
just want to say thank you. We're very excited. Dr. Serpa is a great champion for how we can additionally enhance on a regular basis, including recently, or not that, somewhat recently, having laboratory services in there. So she's really been doing an outstanding effort along with Jeff and a few others of trying to look at what can we do to make sure the person while they're there gets full integration of care. And I appreciate bringing the continuous improvement.
Thank you, Tracy, to you for your support along the way, for believing, in some of these crazy ideas that I come and bring to you, and hoping that you're gonna, get as excited as I get. I look forward for us being able to be as inclusive of a practice as we could be from the psychiatric perspective, to be able to offer most of what I call a one-stop shop whenever possible, and make, the life of the patients that we are here to serve a little easier. They face enough challenges that if we bring some of these services, along, we can then maybe make a better difference. So I appreciate the opportunity.
Thank you, Doctor.
Okay. Thank you.
Is there anybody else from the public wishing to speak? Anybody else? All right, we will close the first hearing of the public. There is one more before the end of the meeting, and we'll move on to item 5, which is minutes. I'll take a motion to approve the CMH full board meeting minutes from December 17th, 2025. Motion from Lori, support from Donna. Are there any changes, edits to the minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Item 6, approval of standing committee meeting minutes. We did not have any this month, so we'll move on to item 7. These are all items that are up for approval. We will start with item A, request to approve the MDHHS initiated amendment to the fiscal year 26-988 grant. I will take a motion to approve.
Support.
Motion from Megan, support from Lori. Leslie?
So the state of Michigan has graciously decided to award us additional funds. We were just informed when they opened the amendment in egrams and let us know that that is why they did it, to hire an additional part-time staff to assist in the crisis calls that are coming in through their crisis line. So we're very excited to be awarded that additional funding to assist our staff and improve our crisis services.
And if it's helpful, may I add, it's actually to act as the backup. So you have like the national line, and then you have the state of Michigan, and currently there's 3 providers, us being one of them. So they're giving us, for us to be the backup for the other 2 providers in the state of Michigan, if that's helpful.
Thanks, Tracy. Thanks, Leslie. Are there any questions? Okay. Thanks, Leslie. We have a motion and support. All in favor say aye. Aye. All opposed? Motion passes. Next is item 7B. I'll take a motion to approve the MCCMH Board 2026 meeting schedule. Support. Motion from Donna, support from Jackie. I don't really have anything to say about the schedule. It's pretty basic. Second and fourth Wednesdays, unless there's a holiday like November and December. So if I screwed anything up, let me know. But for now, we have a motion and support. All in favor? Aye. All opposed? Motion passes. Calendar is adopted. And we'll move on to item 7C, which is requesting approval for paper record disposal not to exceed $35,000. I will take a motion to approve. Motion from Sharita, support from Julia. TJ, go ahead.
This is requesting approval for $35,000 for the destruction of documents that we currently store with Iron Mountain. This equates to a little more than half of the documents that are currently stored at Iron Mountain. We've identified them and measured them against our policy 10.04 Code 15 for document destruction, and these meet the qualifications for destruction. And I'd be happy to answer any questions.
Thank you, TJ. Are there any questions? Okay, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes.
Thank you.
Thanks, TJ. Next is item 7D, request to approve contracting with one vendor for equine therapy services. It is the recommendation of the procurement committee to extend the contract to Therapy Ranch, and I will take a motion to approve. Motion from Jackie, support from Donna. Christina?
Good evening. This is a result of a request for proposal that we issued for equine therapy services. This is a new Medicaid reimbursable services for waiver individuals. We did have one bidder, and we do feel that this bidder meets the qualifications, and we would like to extend a contract. We are actually working with this vendor already under a grant project and have seen success, so we feel confident in extending.
Thanks, Christina. Are there any questions? Okay, seeing and hearing none, all in favor say aye. Aye. All opposed? Motion passes. Thanks, Christina. Next is item 7E, requesting board approval for brand video creation not to exceed $30,000. I'll take a motion to approve. Motion from Donna, support from Lori. Tracy?
Around a year and 2 months ago, give or take, we came to you and we had a marketing, and you guys approved that. Well, the reason why we're bringing this back to you, because we had the bus laid plans, had drafts, and then the RFP happened. So we then had to switch all of our kind of focus and was not able to do this. Now we're bringing this back to you. Although you've already approved it, we thought it was in our best interest, just so it's clear. This one's actually a little bit cheaper. The last one was about $35,000. This will be under $30,000. If you haven't already seen our AOT videos, it'd be a very similar fashion. We really are trying to create videos that are conducting outreach, educating, but very simple and very long-term. So what I mean by the word long-term, we want this to be generic enough that 5 years from now, we would still be, you know, you guys have all seen those videos where you're like, they made that in the 80s. Right. Our goal is to not have any identifying information, so we can use this for many years to come.
Thanks, Tracy. Are there any comments or questions? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. And the last item is 7F, request to approve 25-26 PIHP Agreement, Amendment 1. Take a motion to approve. Motion- That's okay. Motion from Megan, support from Sharita. Tracy?
This one we actually just received Tuesday, I think it was, Tuesday. If you notice, it's very simple. It's both in the bar, but also if you look at the attachment at the bottom of the page, there are the edits that they're requesting. Most of them are very minor, and what it is a language, like they had an error in the way, according to the federal government, how they had worded the ABA rates. So if you'll notice, there's language change to that. And those are just, again, minor legal changes that we don't have any major concerns at this time. The only thing that I would draw your attention to, that I will give a little bit more detail when I do the CEO update, part of it does have what they call the rate certification as an attachment. So you have the contract you sign, right? And one of the attachment is a rate certification. And Ken, of course, would do it justice. So if you have detailed questions, not me, Ken, that rate adjustment does say that they have funded the DCW wage increase, because minimum wage is going up, and then it's going up again next month. Our calculations we have questions about, and Ken can go in a little bit more depth. So that's really the only concern for us, is the rate certification is a little concerning about what it says it is, and then what it directly translates into our local funding. But we have no other concerns besides what I've just mentioned.
Thanks, Tracy. Are there any questions? Any questions for Ken? Okay, seeing and hearing none, all in favor say aye. Aye. All opposed? Motion passes. Now we'll move on to item 8A. This is a receive and file CMH Communications quarter one 2026 report from Airfoil by Tracy. Take a motion to receive and file. Motion from Dana, support from Antoinette. Tracy, go
In
ahead.
front of you, this is the document, it's rather lengthy. If you, when you get a moment, please review it. And of course, it's also, we can send it out as an attachment if that is more convenient for you. Just as a friendly reminder, we bring you quarterly updates on our marketing and social media activities. If you summarize this, what you will learn is our our engagement continues to go up, right? The number of people who are interacting with us. Our best engagement was, of course, the SUD Engagement Center. We should also know that. Right behind that, I think it was the op-ed that I did on kind of like the bid out and what's happening. You'll also see in here that both Facebook, Instagram, and LinkedIn, thank you, continue to rise, and it does list the specific numbers of each one of those followers in case you're interested. The last thing I would like to point out is near the back of it, I actually would encourage you to read it. It gives some kind of summaries, like during this last quarter, what have we learned? What has worked, what isn't working, that type of thing. And then it does give some kind of futuristic items, including the mention of the brand video that I mentioned. Overall, you'll see that we have more engagement. We're posting more video interaction type of activities. If you haven't seen it, Helen and I are famous, right? We do like a whole thing. So we're continuing to try to do that. I know there's one with Christina. There's lots of us trying to do that. We tried to convince Ken to put a hat on. He wouldn't go. He wouldn't do it. Just
I wore the hat, I just didn't want to be on the video.
yeah. So we're really trying to engage in that more interactive way. So hopefully you've noticed that that continues to grow over time. And of course, I'm happy to highlight answering any other questions you might have.
Antoinette?
Did they say why they thought the Instagram was great?
Yeah, and unfortunately, I don't have a concrete answer. It's a great question. I know that, as you know, we're newer to it, but it's still, you can see it, the trend. It's just not any there. The only thing that I think we need to do better at, and we think we've said this in the past, right, is the video type of interaction. Because we have some, but we don't have anywhere where we need to have it. And we're just trying to slowly expand on that.
I agree with that. I think
Yeah.
static.
Like a story kind of thing, like, yeah.
Carousel, like pictures or whatever. They do love the videos with you and Helen. That seems to be really popular. But I think the other thing that's popular, just looking through what was done over the quarter, the idea of this affects me. Like some of the stuff that didn't do so well was pretty general, like you should stop smoking, this is who you can call, or you can do this or you can do that, and it's like here's a link or whatever, and that was kind of at the bottom, but where it was like this is happening in your neighborhood, this is happening in your county, it kind of like, oh wow, they're talking to me, this affects me. So I think more of the telling the story of our community and how we are there has proven to do really well, so I think that's great. And then I think more of us share on Facebook too. I try to beat Lori to the share. You just share so quickly. Every time I'm gonna share, and it's like she's already got it. But I think more of us share on Facebook. Get up at 5:30. I know.
Don't do it. Don't do it.
And I honestly don't think I've naturally seen us on. That's one that if you are on Instagram, they'll
Yeah.
share some. But yeah, I think it's doing great. Thank you.
And I just want to say that, as always, you're on point in the way that one of the things that we've recognized, kind of what you're suggesting, is the Mental Health Matters Awards, which I'm going to try to, highlight again a little bit later. Yep. We're trying to take the winners of last year and do stories, but it's about the person, but it's actually about like a success story in our community. To your point, the spin is going to be a little bit about like this is happening in here and this is what they're doing, and so it's celebrating them, but it's also trying to celebrate the community and also encouraging them to interact. So I do definitely agree with you.
Anybody else? Okay, as you read through it and you have questions or comments, shoot them our way. And with that, we have a receive and file. Please, all in favor? I'm so used to the automated machine. Just please vote. Go ahead. All in favor, say aye. Aye. All opposed. Motion passes. We'll move on to item 9, resolutions. We have no resolutions tonight. Item 10 is the voucher listings. I'll take a motion to approve paying the bills.
Support.
Motion from Sharita, support from Lori. No questions, no comments on the bills. Hearing and seeing none, all in favor say aye. Aye. All opposed? Bills are paid. Ken's ready to go with the CFO update.
Good evening, everybody. I'll start by diving into the report like I usually do and circle back to some narrative type things if we don't cover it in the document itself. So page 80 has our revenue and eligibles trend here. We only have 2 months of data, and I need to format the tables to include the prior year data, which I just ran out of time to do. But the trend is the same regardless. What we're seeing is a downward trend in eligibles, and as a result, revenue. We've been talking about this for a while. We, had a conversation, was it Tuesday? We had a PIHP CFO meeting, so all 10 regions get together. We aggregated this data by region. Every region is seeing roughly the same drop in eligibles, enough to be concerning. As part of the PIHP CFO meeting on Tuesday, which I'll dive into more of those details, but for this one specifically, we had Keith White there, who is the head of actuary at the state of Michigan, to voice some of our concerns. So did acknowledge that there's a drop in eligibles, maybe not seeing on their side as steep a drop, but that there is one. So we tried to brainstorm some solutions and things like that, so that was productive. But anything that they see would be caught up in a mid-year rate adjustment, which usually occurs in the spring, early summer timeframe. So as a result, not only do we have our drop in revenue that we budgeted for as part of the initial rates, but also another $6 to $7 million on top of that we're projected to lose as a result. So that is a concerning trend, but hopefully it is corrected over time. It's going to continue, I think, to get worse as changes at the federal level, especially over the next year or two, come through as far as work requirements and biannual eligibility things. So trying to keep a close tab on that as we possibly can. The next page is largely related to our balance sheet. I don't have anything to cover there. Page 82. The only thing I wanted to draw your attention to down there is kind of the net income box at the bottom. You can see that, kind of the picture in our budget's playing out here, right? We've got expenses that are slightly less, but revenue that's quite a bit less. Hence we budgeted for our pull out of the ISF. I think it might be a little bit more than we thought it was because of this eligibility trend. So we'll keep an eye on that as well. The next page, page 83, this is our funding source bucket report is kind of what I call it. So as we talked about the budget a few months ago, and just generally speaking, we finally have our first numbers on paper as it pertains to fiscal 26. And again, unfortunately, as projected, it's not a very rosy picture for fiscal 26. You can see the first two boxes there for Medicaid and Healthy Michigan. If you add them together, we got roughly $800,000 loss. I think that number is light, and we didn't have a full claims run out for the time period in question. Our providers are also trying to wrap their year and do some other things. So I actually think that number is going to be a little bit higher if we were to run November numbers, say, next month. So I want to put that out there as well. So when we go down to the CCBHC boxes, this looks a little bit different this year. We don't have base and supplemental anymore. As you'll remember, we moved to CCBHC direct pay starting on 10/1/25. So we bill the state directly for these. This is not a good thing I can't think of a single reason that it was a good idea. So these numbers here are reflective of a fee-for-service arrangement. I did not try to book a receivable with like a collectible percentage or any of that. This is kind of our worst case scenario as it stands right now. And that was deliberate. We are going to collect more of these. We have a lot more errors to work now. So revenue is low, but that expense is still, I feel, an accurate representation. If you add those two boxes together, just through November is a little over $3 million loss. So CCBHC is probably our biggest risk right now, unfortunately. And we'll see when I'm hoping in February I can bring some 25 numbers back, at least pretty final, if not final. The removal of 3 CCBHCs in our county from DCOs to separate CCBHCs was a significant financial loss for us, and it continues to play out into 2026. It's not clear yet if the state is going to, they call it rebase, our fiscal 26 PPS 1 rate based on our 25 results. So in theory, if they did, our 25 results would drive the rate up, and we would kind of catch this up in 26. But we don't know that yet. So I certainly keep the group updated on that. You'll also notice, maybe I'll stop there. I've said a lot of words before I keep going into any further. Today might be a longer one for me, so I'll apologize. But
Donna just asked for a hard stop there. Like, you're done. You're not
right there.
Ken, I don't see any questions. Continue.
Okay. At the bottom of 83, you can see our ISF. I expect us to, as the group knows, we continue to dispute how the ISF is calculated. Every year we've presented based on the ISF analysis that we do what the balance should be. Even on that analysis, we're projected to be overfunded in 25. The reason being that we earn interest on those funds, and we have to record that in that fund, and it actually pushes us over even our analysis as far as that goes. So the numbers look strange down there because we will have to give some money back from the ISF, even based on our own analysis. So does that make sense? So our analysis shows 58.9 million is the max ISF. With interest, we're gonna be at 60.3 million. So in 26, we're gonna have to, it's gonna kind of come out in the wash because we're gonna draw on the ISF anyway, but we have this little bit of extra dollars, like $1 million or so, that we have to account for. So that, I just wanted to highlight that as why that looks kind of weird. We actually have a meeting, Richard and I, tomorrow to talk to the new ISF actuaries about our final results. So we should have a 2026 report, hopefully by the time we have our next meeting, and have a better number there. That's my goal. So flipping to the next page, page 84. This one, our non-Medicaid GF spend continues. Nothing's really changed there. We continue to provide those services. The state has a very small allocation that we don't know what that is for 2026. We won't know what that is till the summer, but it's borderline immaterial for our program. So, but that's not a change from the prior years, but we try to control that spending to the extent we can. State general fund, we're actually running a small surplus if you don't consider CCBHC non-Medicaid. So we continue to control that cost and utilization very well, and that's a group effort from everybody to make sure that we're utilizing that and giving it to the people that need it the most, frankly, for those limited dollars. And then at the bottom of 84, you can see kind of the culmination of everything we have going on, and it's a 2.7 million draw on our fund balance, effectively. So anything we've banked over the years, and that's just through November. So if we extrapolate that out, we're probably in that $12 to $13 million range. So CCBHC is going to be critical as part of that. Just getting our legs under us to be able to bill it was a task for the first 2 to 3 months of the year. So now we're in, okay, we've got the submission down. Now we need to work the AR and that kind of stuff. So I think that'll get better as time goes on. The rest of the pages are our usual income statement and balance sheet stuff. I wasn't going to cover anything in particular on those pages because I think the report I just went over is more useful, frankly. But if there's questions or concerns about any of those pages, I'm happy to go through those. Okay. As I stated, I have some narrative items as always. I'll elaborate a little bit more on the PHP CFO meeting because there was a lot that happened there. As the group is probably aware, there was 2 minimum wage adjustments recently. There was one in February of 25, I want to say, and one that just occurred on January 1 of 26. The one from 2025, we were told that we'll get the funding for that like next week. So a year later after that, 2025 really isn't a problem. We continue to run a surplus on the Medicaid side in 2025. So that funding is, I'm going to say, appreciated but not useful in 2025. Where we spent most of our time talking is the minimum wage increase on January 1. And I would encourage this group, Tracy's board report has more detail in a written format if you want to refer back to it. I would say that the bottom line there is minimum wage went up. I'm trying to remember the exact amount. I want to say it was $1 and some change in January. The state in their rate certification, which you can see as Tracy referenced, put $23 million, that's statewide, into funding that, which for comparative purposes, when the total aggregate DCW increase for all those increases, which added up to $3.40, was about $360 million statewide. So we have quite a difference there. And in talking to the actuaries, we can get there where it's a little bit more of a smaller incremental increase over the previous rate plus DCW, but we can't understand the large disparity between those two. So we asked a number of questions about that. We understood what sources they used and ways to calculate it, but we don't have the detail behind it. So that was one of the things we asked was, how much did you allocate per region? And further for us, we can't really do much as far as adjusting rates unless we know what it is by code. So that was one of the takeaways from that. We talked at length about the assumptions there. They're basing a lot of their information on surveys that providers fill out. But at times the instructions aren't clear. So if that DCW amount was included in the base survey, it would skew that and would make sense why that number is so small. So we offered a lot of that feedback as a group. It was a really productive meeting. So we certainly appreciated the actuaries at the state taking their time and hearing us out on some of that stuff. Any questions about that before I move on to a couple more things?
I don't see any. Go ahead, Ken.
January and February is where finance shines. We have our reporting due at the end of February and audits ramping up, so I'll keep the group posted on that. What else do I have here? Oh, I missed one of my things from the PHP CFO meeting. We did offer some narrative about the CCBHC. As the group probably remembers, they pulled funding back as the direct pay ramped up, and we felt that was not calculated appropriately. So based on our 2025 results, we're going to get back to the actuary team and say, here's what actually happened, here's what you pulled back, and hopefully we can find some middle ground there to help our Medicaid rates in 26. So, no, that was a lot. More than usual, maybe, I don't know, but happy to take any questions or concerns if there
Thanks,
are any.
Ken. Are there any questions right now? There's a lot of digesting going on, I think.
Yeah, and I'm happy to discuss further if you think of something later or whatever the case may be. Certainly reach out to Tracy and we'll figure it out. So,
Thank you, Ken.
all right, thanks.
Appreciate the update. Now we'll move on to Tracy with the CEO update.
So we'll have Ken stay close just to keep the finance fund train rolling. right? The one he didn't as mention, not that he needed to, but is the Wasco settlement. So just as a friendly reminder, late yesterday afternoon, you would have got your board report. So if you haven't already checked it out, remember everything I'm telling you and then some, right, can be really there, and it does a better job of giving you a little bit more of the details. But it does mention the Wasco settlement. That should sound familiar to you. The state has given guidance. In that guidance, they have acknowledged that all of their guidance is not consistent. So where we're at is we, of course, want to be in compliance and we want to follow all the rules, but we want to also make sure we're following all the rules, which means we want to make sure that once they update, they have something called a technical guidance, then they have the Medicaid manual, right? Those don't say the same things. So they put out guidance saying, do it this way, and then acknowledging that all of our information doesn't match, but we're going to work on it. So just so you know, if anybody's asking any questions, we want to make sure we're in compliance, but we also want to make sure we're following all of the rules. And I did attach the memo and the L letter in case somebody in the community is talking with you about it. Overall, we are always in support of the people that we serve in the community getting as much funding as possible in order to provide the services that are needed. Where we are concerned is this is very open-ended, right? And it has not only conflicting information, but it creates very challenging situations where, let's just say, other things that we would all not support would not be maybe in agreement with. So I guess I'm just giving you an update. We are also concerned from a financial perspective, right? So how it is outlined, it is not financially feasible for us to do. Also, how it is outlined, it is not administratively possible for us to do in the manner it's outlined. So again, our goal is always to support the community, do what we can do, but know that we are expressing on a regular basis kind of questions and trying to work through that with all parties. Also, Ken did mention the DCW rate. Understandably, our providers, right? There's this document that the state went ahead and publicized, and this is in your report, saying you must pay this. And it basically equates to, once you include everything, they're like 1713. Well, a lot of our providers do already pay 1713, to be fair, but there's some that don't, right? And they're also, some of them, also frustrated because there's not funding there yet. So I just want to acknowledge that we have amazing providers. We have been meeting with them. We're working with them on a draft kind of advocacy letter. So some of the language, again, I'd really encourage you to read. Ken said it verbally, but the written kind of explains it in a little bit more detail of why the detail matters. Because basically, again, 23 million to have everybody in this particular region make 1713 an hour. And remember, 23 million is for the whole state. That is not enough money for a few regions, much less the whole state. So the good news is, though, they're having good, productive meetings by sharing concerns that Ken mentioned. So we're optimistic about a way to communicate, of course, a way to communicate that. So again, please read the additional information so you have a general concept when the community starts to question these things. So I just worry that the state of Michigan has been putting out these communications to the public, and if I was the public, I would think the same thing, right? Does that make sense? So we just want to make sure to be on their side and advocate for them so we can all get there together.
I just wanted to highlight too, is something I forgot, is just to remind the board that we deliberately, even though we were facing a revenue shortfall, offered 3% largely across the board to the network at the beginning of this year to support rates and the Earned Sick Time Act and minimum wage and pick those things. Should it come back that 3% isn't adequate or there's some kind of difference there, we'll certainly analyze that. But I thought it was relevant to bring that back up and mention it. So.
Agreed. We're trying to be as proactive as possible to do that and trying to meet in the middle and understand their perspective. And I appreciate the work of Ken and Christina and several people who continue to try to work with the providers to support them in every way possible.
Donna?
I'm just wondering, was there a formula or something? How did they come up with 23 million? I mean, does anyone know?
We do not know. that was one of the asks. So I kind of touched on it briefly. And like I said, they took all the provider surveys kind of from the state. And in those surveys, it says, what is your base rate? So they aggregated all that information and then said, okay, what would it cost based on those surveys to bring your base rate up to 713? And in the aggregate, that's how they came up with $23 million.
Who did the surveys?
It's something that comes from the state of Michigan through their actuaries, Milliman. So the surveys come out. We do a more detailed version of it because we're a CCBHC, but our providers who aren't fill out this survey. And like I said, it's a lengthy and sometimes the instructions can be ambiguous at times, so it's not clear if there's errors in those surveys. You're basing a lot on that. So, and that was conveyed as a concern as well to the state. So again,
So it's like a spreadsheet. It's a very sophisticated spreadsheet, because I don't want to minimize it at all, right? It's very well thought out. But if it's helpful, I think our providers are amazing. They have they created an, to be helpful, a 45-minute video for someone how to fill out the form, and then the providers thought that was funny, because if you have to have a 45-minute video of how to fill out a spreadsheet, that should be an idea that maybe it's too complex.
we spent a lot of hours as a group with the CCBHC side of it. Richard and I and some other folks from Raymond, to many hours to digest what's in there. So it's complicated, and that survey's not quite as bad, but it's still, there's a lot going on in there. So anyway, that's the information we have about how it was, but we were very clear that we wanted to get more detail on that so we can get an accurate calculation together, quite frankly.
And to be fair,
So,
that's everybody's motive, right? They're trying to collect this data because they want to do it right? It's just there's some growing pains for all parties to make sure what they think they're asking, they're getting. So now I'm gonna hopefully switch subjects because that's a lot of finance. So also in there, I'm just drawing your attention, if you haven't read them, please do. We had a great article in Metro Parent, and we also had, I believe, the Detroit News one, if you already haven't read it. I am gonna remember every month we do the board education. So this month in front of you, you have this. It's also as an attachment in there. It is and this is where Lori and Jackie, since they already heard the spiel, can kind of go somewhere else for a minute. She asked if she could leave, so I was just giving her. So, grievance and appeals. You guys all know this. There's many, many, many ways, and that's a great thing for the people that we serve in the community to air their concerns, give their suggestions. Grievances is they're unsatisfied with some type of service or not getting services timely, someone not treating them with dignity and respect. Those would be examples. So we actually have in this report the number of grievances we just received, the type of grievances, and then kind of the outcome in there. Same thing for appeals. Appeals are, someone was denied, thank you, an authorization, or their services were changed. They have the ability to appeal it, right? And then in this report, you will see the number of appeals, the types of appeals. Then you'll also see in here, like, was an appeal one? What I mean by one, was it upheld to the original decision? Or did that appeal cause the decision that was originally made to be changed? Sometimes it's even like a modification of it, right? Like maybe it's not a complete no, maybe there's an edit to it of some sort. So this is the data for that. We are producing this for you because it's helpful for people to have an idea of the different concerns that arise in our community, but just to be clear, this is not the only way for someone to, these are very specific ways for someone to share information. We still also have compliance, right? I'm going to report fraud, waste, and abuse. We still also have customer service, right? There's different ways, so I'm just acknowledging these are two. I'm also acknowledging that for you because we're going to move towards a system that tries to take all this as an aggregate data, right? So you have these types of grievances come in, you have these types of appeals coming in. Then we have some other phone metrics and things that we're looking at, right? How long to answer, to try to create a more comprehensive, like, what does all of this data say for our organization to then make some recommendations? Because what you'll see at the back of this report is kind of an analysis of, based on this data, what did we learn this year? And then at the very end, it gives kind of specific actions that the group of individuals who do this, what they're going to do in order to enhance this and make a difference in 2026. So again, if you have not had a chance, please read through it. I think it's very insightful and helpful for you all as board members to know what's kind of occurring and where the concerns are potentially arising and the direction and the actions we're taking to address those concerns. So that was almost as fun as finance. Okay. now we're moving on to something more, a little bit more fun. In front of you, many of you have already RSVP'd, but several of you have not. So this in front of you is the formal invitation. There is the QR code. We would encourage you, the QR code is actually to RSVP. So this is me personally delivering an invitation to you in order to attend, if possible, the Mental Health Matters Awards. Nominations are already open. I believe we have, I think I looked earlier the other day, I'm gonna say 39 nominations, which that's good, but that's not that great. We'd love to have more. If you're out in the community, please share these. We actually have decent nominations, but we really want to get the widespread community, right? So if you're in the community, if you could share it or on social, right? We post it. When we post it, please reshare. Many of you do, but any additional ones we would greatly appreciate. I had the privilege of being on a panel discussion Friday with the Wayne in Oakland of the other CEOs. And it was at the Kevin Song Conference, if you're not familiar with that. It was a great opportunity. It allowed, they did ask some, questions about the bid out and kind of just putting information out there about what are the challenges in all those regions, and then how are we partnering in order to enhance the community. So I always think those are wonderful, because it allows not just the community to see that there is such positive commonality in the metro area that I don't think people recognize that it's occurring. Sometimes we use different language, but either way, we're doing a lot of the same creative things, especially when it comes to the expansion of our crisis continuums. I think I have covered everything. Yes, and again, please read your board report where you're going to get a better version of what I just said.
Thank you, Tracy. Are there any comments or questions? Okay, moving on. Next is item 12, other possible agenda items. 2 reminders, we have program and budget February 11th here at 6 p.m. And we will have full board here Wednesday, February 25th at 6 p.m. Now that you have all approved the calendar, we are moving into February. And I have 2 more items to add. The first one is going to be at your seats. There is a memo from me and an attestation to fill out. If you could do that before the end of the meeting, that would be greatly appreciated by myself, Tracy, and Sandy. Basically, we had a little bit of a requirement, not a change, but an addition to the makeup of the board. And this came down to us. This was not made by us, but the addition is now for no more than 1/2 of the board members may derive more than 10% of their annual income from the healthcare industry. If you have questions, if you're confused, please ask us, because we did not word it this way either. Megan.
Can I ask a question? Okay.
Yes, you may.
Kind of a meatball, but
You're in HR. You're not a meatball.
so it's the double negative that always gets me.
Yep.
Yes, I receive no more than 1/2. Means I don't. Yes,
Correct.
I don't. Okay, thank you. Just clarifying. I hope you guys looked at it.
If you answer it incorrectly, we'll double check it and we'll let you know.
Okay.
Yeah, it is a little tricky, but just wanted to get that out to board members. And then I will work on notifying the Board of Commissioners staff, because this will have to be part of the application process, which is coming up very soon. So I want to get this in front of you tonight so that we can have our applicants start applying in February, have this in front of them, and for us to be up to date and make sure that we are good to go. But Teresa and I have talked, and as of now, as far as we know, we are compliant. We're good to go as we sit today. So please fill that out. Donna, yes. Yes, it's everybody. It's just like we do every time around with, are you primary, are you secondary, all that stuff. This is just an additional question to that application. Any other questions on that before I move on to the next thing? Okay, next thing is a good thing. Since we were talking about compliance and grievances and appeals and all that stuff, Lori and I sat on or do you want to speak to this? I'm on a roll. We sat on basically the closeout of an assessment for our Office of Recipient Rights, and we did fantastic. Our team scored fantastically. I believe the exact numbers were we scored 345 out of a possible 348, and the only reason we missed 3 is because we missed 1 point that was weighted 3 times. So really, we only missed 1 thing, and it was only by about 2 percentage points, or else we would have been 100%. So I want to give a shout out to our team, our entire team over there. They do fantastic work, and this just shows what we already know. So congratulations to our team, and thank you for all that they do. And with that,
And I would just say we already submitted our argument of the trying to argue the 3 points.
so
So
we're
Helen
fighting for
and Andrew did a
100%.
great job of being like, no, we don't agree.
Are there any other board members with anything else to add? Go ahead. Anything you want that's relevant.
To tonight, in general.
It could just be relevant to you.
It's
Whatever you
relevant to
want,
me.
Megan.
So I feel, and I know we have a closed session, so I'm gonna be quick, but I feel like oversharing tonight in this room of very close friends. Last year was a very, I'm gonna try and do it without crying, but last year was a very tough year for me. Mentally, which I don't really think that I realized at the time. I had a wonderful conversation with Dana when we went to dinner. I can't even remember when that was. But I struggled a lot, as most of you know, because I'm a big mouth. I'm a type 1 diabetic, and I have been for a long time. And the chronic illness just wears on you sometimes, and it just shows up in unhealthy ways, and you feel silly complaining about it because it's something you just have to deal with. But I really, really, it was a very rough year for me. And, I wear my t-shirt that says "End the Stigma," which is the coolest shirt in the world. And, I see all of you, and it feels like it just started to feel fake to me, to be that person who, again, culturally, I'm Lebanese. We don't talk about it. Pull yourself up by your bootstraps, whatever. So I talked to Dana shortly, I think it was right before I had scheduled an appointment with my doctor. And I'm happy to say, I was put on an antidepressant, and I feel so good, you guys. I feel so good. It feels so scary, and it feels like, it just feels like maybe, like, why can't I just do it? Especially when it's not even like a thing that's a choice. But just like you all encourage me so much, and the stuff on LinkedIn, and just seeing your faces and being a part of this, and it just felt fake that I wasn't willing to do that, and having wonderful open conversations. Like, that's how you end the stigma. So in front of this room of all of my close friends, I just want to say, like, and encourage, and anybody who watches MCCMH board meetings on YouTube's after the fact, like, talk to somebody. I swear to you, no matter what, judgment free. For real, I feel so good. Swear to you, by the grace of God, I feel so good. And I love you all, and I'm just feeling so good, and I just wanted to share it. I do. I just wanted to overshare tonight. So
Thanks, Megan.
unrelated, but related.
It's related. Lori.
I just want to know, I'm going to be sending out for our,
Pack?
our pack, thank you.
I know where you're going.
CAC, no.
Dues, money.
How we normally give every year to board members. That's just recently come out again, so I will be emailing everybody. And then it has a nice little thing you can scan and just do that, so I just wanted to give everybody a heads up on that, it will be coming.
Thanks, Lori, for the reminder. Yes, it's not easy tracking all of us down. Shaking all of us down. Yeah. Anybody else have anything to add? Okay, seeing none, we will move into provider comments, and we have Karen Wood here, who is the CEO of MyCare, who's been waiting patiently to present. And there is a handout at your desks, board members. And Karen, go ahead.
I have some packets for you all. Are you Sandy? I promise, Sandy, I'll stick to the 5 minutes, okay? I should have given these to you before Thank you all for this opportunity to speak to you tonight. I'm Karen Wood. I serve as the CEO of MyCare Health Center, and it's nice to see some friendly faces, some familiar faces here in the group, so thank you for having me. I believe you have my PowerPoint. I'm just going to kind of use this as a guide, but it has a lot of information in it. If you have any questions afterwards, just let me know, because I hope to stick to the 5 minutes. My Care Health Center opened in 2010. We are a federally qualified health center. We became a FQHC in 2013. We are a 501c3 nonprofit organization. And we've had pretty significant growth since inception in 2010. It's actually 127% growth. So we've had really a lot of growth, increased service sites, increased patients, and just 10% in the last 2 years. So really a lot of people out there that need our services. Our mission and vision is covered in the PowerPoint. We are a community-based provider. We have some federal funding. It's modest federal funding to be a safety net provider, and that is to make sure that no one goes without care. We're mission-driven to provide affordable care to everyone. We have a sliding fee scale for the or underinsured, so we do not turn people away based on ability to pay. Comprehensive services include primary care, behavioral health, dental, medication-assisted treatment, podiatry, case management, transportation, and pharmacy services. We're governed by a volunteer board of directors. 80% of our board are consumers of the health center. They all live or work in Macomb County, live and or work in Macomb County, or our service area. Quality standards, because we're federally funded, like you with your new requirement about having, I think it was 50% cannot, or we have the same requirement. So federal standards, we have operational site visits, they come on site, and we have to comply with very stringent federal regulations to be a federally qualified health center. Why this matters is because we reduce health disparities, we improve access, and we integrate physical and behavioral health. I really feel strongly that we are healthcare's best kept secret. We are, there's no wrong door, we're there for everyone, and we just are really proud of the partnership that we have with CMH. It's a long-standing partnership that I'll get to in a couple minutes, but it's really good care. We focus on underserved populations. People literally would go without care if we didn't exist. We pride ourselves in our collaborative partnerships, and we are a patient-centered medical home model. So we're recognized through NCQA and Blue Cross Blue Shield as a PCMH. 4 locations, one in Mount Clemens, stone's throw away from here, Clinton Township, co-located with the north location, and then 2 locations in Centerline. Our service area does not it extends beyond Macomb County. We actually pull from Macomb, Wayne, Oakland, and St. Clair County, so you do not need to live in the county to come see us. Our 4 locations, the different services, they're a little bit different location to location, so those are listed in the PowerPoint. At our Clinton Township location, we do offer medical and behavioral health. At the Mount Clemens location, which is very close to north, we have medical, dental, behavioral health, psychiatry, medication-assisted treatment, podiatry, case management, and insurance enrollment. The CFO, Ken, spoke a little bit about people losing coverage and how that will impact you. It's going to impact all of us. So we're going to really need to work together to help people get insured. So that's going to be anybody that touches that patient needs to help them, whether it's a workforce requirement or a Medicaid application or a marketplace or whatever we can do. We're going to try really hard, and we've actually modified our care teams and added care team members that are community health workers and also certified application counselors. They are trained to help people find out if they qualify for insurance or what they would qualify for. If they don't qualify for anything, we're going to enroll them in our sliding fee program and take care of them. There's pictures of each of our clinics in the packet. We have the cutest little health center in the north location. Please, if you want to come see it, I would love to give you a tour. I just love that little clinic. It is so small, but so cute, so inviting, and I think we really do a good job of treating people with dignity and respect. So in the packet that Sandy passed out is a little postcard. There's a QR code on it. If you want to have a tour, just take a picture of that, and I would be happy to personally give you a tour to any of our health centers. We talked about the comprehensive primary care. We do behavioral health, psychiatry, mental health counseling, substance use disorder, medication-assisted treatment, peer support, recovery planning, and women's health and dental care. Our patients have grown significantly. Last year, we saw over 6,000 patients. In about 58% of those are on Medicaid. So we're taking care of people that really need that help. We see about 150 people a day across all locations. We really try to collaborate with community partners like Community Mental Health. We are the CMH physical health provider for the CCBHC program, and we also are a SUD health home provider as well, so we contract with that as well. We also are the CCBHC physical health provider for Easter Seals Morgue at our Centerline location. We have kind of a very robust data analytics platform that I use extensively and all of our staff use extensively, and we share that platform with CMH. It's called Azara. It's amazing. It really helps us identify the sickest patients, the patients that need the most help, identify gaps in care. I can run a lot of reports and just really have staff help the people that need it the most. We focus on all whole person care. We're a safety net provider. We support the CCBHC program. There's no wrong door access, and every point of service is an opportunity to help people. I talked about Azara. I talked about CCBHC. There is a page in here that's a success story. We are lucky to have an integrated specialist. Her name is Lori Doyle. She works for CMH, and I think 3 days a week she works out of our Mount Clemens location. But she is a liaison, and she helps people, whether they're coming from my care that need help from CMH, or even from CMH that need a physical health provider. And it's just been a wonderful partnership, and I really applaud Agnes's vision for that position and that grant. It has been highly successful. I included a success story in there for you to read at your convenience. MyCare received the Mental Health Matters Community Partner Award in 2023, so we're really proud of that. And on the last page is my email and my phone number. And if you have any questions at all, feel free to reach out to me, but I really do appreciate this opportunity to talk about the work that we're doing and how we're collaborating to really help people that truly need it. So thank you for your time tonight.
Karen, thank you.
Any questions?
Board members, any questions?
Just a statement, representative from MyCare came to an event that I had in Mount Clemens, health fair.
Yes.
And they were extremely helpful. We had more than I thought ahead of time, but we had a large unhoused community come. They were helpful with them. We had 2 guys come from the jail. They were just released. They stopped by, and MyCare was just so filled with information and able to help and guide them. So I just want to say thank you and applaud you for all that you guys are doing over there. You're really community advocates, so thank you.
Oh, that means so much, and I really appreciate it. And it's quite possibly Dave. Was that you, Dave, that were there?
I was there, but it was our medical assistant, Amber.
Okay. I'm here tonight. I'm here with our community engagement manager, Dave Wilson. So thank you, Dave, for that work. And thank you for that comment. It's really appreciated. And, you know, we're all going to have to approach, it takes a village, right? We're all going to have to help people and do what we can to make our community better. So thank you for that feedback.
Donna.
I just want to say I applaud you, and I am just absolutely amazed at the variety of services you offer, from mental health to substance abuse to all the different health services, dental. I mean, it is just amazing. And I really give you an applaud on the back that you can offer all those services to people. And I'm sure that you have helped so many people in our community. I just really give you an applaud, and all of the people that work for you. It is just amazing. So thank you so much. It is just absolutely amazing. You're doing a wonderful job.
Thank you
Thank you.
so much. That means a lot. And, we have a great team and we've got great partners and, that's how it gets done. So thank you so much. Thank you.
Anyone else? Dana?
Can you hear me? I'm pretty loud. I was just gonna say, I think one of the nice things is the dental services that you guys provide, because
Yeah.
that's, I would say, I hear a lot that people don't have access to that. So I think that component is very helpful, and whoever thought of that, kudos for that. So I'll just echo what everybody else is saying, but that's a
So,
great part.
If I could, we built a dental center in Mount Clemens. In 2023, it opened, and we did that based on community need because people could not access dental services. We had a dentist or a dental center in Centerline and couldn't keep up. So we built the other dental center, and it's been very, very busy. And that's what we do. Our board did a strategic plan and, we noticed there was a need and we're trying to meet the need. So thank you for that feedback. Our dentists are phenomenal. I go to our dental center. Yeah. And we were actually interviewed by WXYZ Keenan Smith, and that will air Friday morning. So he
nice.
came and interviewed our chief dental officer as well. And she's just a phenomenal human being. I mean, passionate like I am. And I just would love to share that with you if you get a chance to check it out on Friday morning.
Okay. Thank you, Karen. Keep
Thank
up
you.
the good work.
Appreciate this
Thanks for all you
opportunity.
do.
Thank you.
Any other providers wishing to speak? All right, seeing none, we will move on to hearing of the public. Anybody from the public wishing to speak? Okay, seeing no one from the public, we will move on to item 15, which is going to be closed session to discuss attorney-client privilege memo dated January 28th, 2026, pursuant to MCL 15.2681H. Need a motion to go into closed session. Motion from Megan, support from Dana. I have to do a roll call vote. Jackie? Donna? Lori? Selena? Megan? Myself, yes. Dana? Antoinette? Sharita? Julia? Wayne? All right, with that, we will go into closed session. We are back in open session. I need a motion to adjourn. Megan, Dana, all in favor? Aye. All opposed? We are adjourned.